Thanks, Tony. How special is this? We're in the Major League Baseball offices, and we're just hours from one of the most exciting World Series that I've seen. Let's go into some of the biggest challenges that we have when we take care of athletes that want to play and they're injured, and there's tools that we can use to help them. But there's some issues with this. There's ethical things, there's legal things, there's things that we may be doing that put them at risk. So it's this sense that Spider-Man teaches us that with great power comes great responsibility. I'm going to talk to you about two things that are injected, anesthetics and some NSAIDs, one in particular called Toradol. The rationale for controlling this pain is that these athletes want to have the ability to play while they're hurt or having pain, and they also want to be able to perform despite the discomfort. So typical indications would be you sprain your AC joint, you have a rib contusion, you fracture a toe, seems like you can still play, but there are some concerns. We may be masking symptoms if we use anesthetic, and if we mask the injury, there's a chance that the injury can become worse. So take, for example, a torn ACL. The knee's unstable, and if we make that athlete pain-free and allow him to go back to play, of course there's risk of episodes of instability, tearing meniscus and cartilage. And same with a TFCC tear of the wrist or something like a stress fracture that if we mask the symptoms could go on to become a real fracture that would be a much bigger problem. And we're dealing with this. This is the pressure to play. It's not just the professional guys who are in a World Series competition. There's not a kid that doesn't come to the office each week who says, I got a tournament this weekend, I got a showcase coming up, I need to get ready for it. It's the coaches, there's contract issues, there's a lot of dollars involved at the high levels, and certainly when you get to the later stages of a season in the playoffs, there's more pressure. And there's something mystical about what we can do. How about this? It's cold spray, works every time. But there's something mystical about what we can do. But anesthetic works. I'm going to share with you this one study. It talks about a long-term evaluation of using anesthetic in rugby players. It's used in professional football. It's used in a lot of sports. It's used in baseball. The long-term safety is not known. So this study looked at 100 players over 10 seasons with a retrospective follow-up. So it's pretty interesting data. Here's just some injuries that are representative. Hand injuries are easy to inject. AC joints, those are the most popular. But you'll see some other things like ankles in here that they're injecting with anesthetic. These players say 10 years later, I'd be happy to have that injection again. It helped me. But many of them felt side effects. Many of them felt that their injury was, the recovery was delayed because of these injections. And some of them even felt that the injury got worse. Some of them had residual long-term pain. So the players that were most happy with the injections, AC sprains, finger injuries, rib injuries, iliac contusions, that makes sense to me. The ones that were not so happy with anesthetics, sternum injuries, that sounds scary to me, wrist injuries and ankle injuries, they reported some bad side effects. A guy has a bone bruise in his wrist, the trapezium bone, and he gets anesthetics to continue playing, and that turns into a complete fracture, requires surgery and a long period of recovery. And then here's another injury that we've all seen. Gamekeepers, he's got a thumb UCL tear. He gets injected before every game, but then develops a chronic instability problem. It never gets to heal. And here's a case where a tear of the supraspinatus that was a mild tear of this rotator cuff was anesthetized. Player plays, and then again it's a bad tear and he requires surgery. But here's the conclusion of these authors, and this is published in a very reputable journal, that contusions appear to be quite safe in the context of professional sports to inject for long-term follow-up, but conversely, ankle, wrist, and sternum injuries are less safe. So that's anesthetic. Let's talk about Toradol now. Everybody's heard about Toradol. Toradol is this major anti-inflammatory medication. If you happen to have a problem with renal colic, if you're trying to pass a kidney stone, you're going to go to the emergency room and you're going to beg for this medicine because it works so good in the emergency room for controlling the worst pain you could ever experience. It can be given in different forms. IM is pretty common. It's got a lot of attention in the media because it was used frequently, especially in the NFL, and it became a topic of legal and public debate. So the NFL Team Physicians Organization got a task force together and said, let's make recommendations on how to use this strong medicine properly. So they know that it's been used in the NFL, sometimes to treat injuries, other times just to prevent soreness or to enhance recovery. So they made this task force. They made their recommendations based on literature and best practices. This is what they came up with, published. Administer under the direct supervision of a team physician. So let's not have other people doing it. Should not be used prophylactically to reduce pain. So don't give it in anticipation of getting beat up in a game to feel better afterwards. Use the lowest effective dose. More than 5 days is dangerous for this medication. And when possible, it should be given in oral preparation. This medicine comes in pills. You lose that effect of the injection, which people really like. Should not be with other NSAIDs. And if they have other problems, renal problems, GI problems, you should not be using it. Now, in a very good way, Major League Baseball, the commissioner helped us with this in the baseball community, and they made a memo and a position statement for us taking care of our professional athletes because we were asking about what we should be doing with our players. And they noted that a number of people have been talking about it, and there's been issues within the NFL. So our baseball community made these recommendations. Administer Toradol should be by the club physician, and you have to examine the player. You can't just walk in and say, hey, the patient says I want an injection, and give it to him. It should not be administered for preventative measures. So the guy's going to be pitching and he wants to get a better recovery. That should not be used. It's not for recovery. Read the PDR. There's a little homework assignment. Consider informed consent in writing. That helps with legal issues. And athletic trainers should not be administering this medication. And I just bring up this one thing, is it's all over the media. I just Googled Toradol and baseball. This is the first thing that comes up. April 2012. This is a New York Times. Mets pitcher R.A. Dickey tore his plantar fascia in May. He went to a treatment that in recent years has become a go-to elixir for professional baseball and football players, the injectable anti-inflammatory drug, and went through a whole bunch of these ethical and legal issues with using this. I just wanted to frame this for some of the therapists and athletic trainers here. What we're talking about is if you put the anesthetic into the joint, there has been occurrences of the joint rapidly destructing where all the cartilage essentially dissolves, and it's a unrecoverable situation. So that was used with long-acting infusion of anesthetics. So that's where Stan's question came from. Single injection, is it still safe to do when we've heard of all these really terrible disaster situations with the continuous infusion of anesthetics? Well, that's a great question. It happens all the time. A guy takes a foul tip or gets hit by a pitch and his toe fractures. If it is safe, of course, for him to play because there's no consequence of furthering the injury or having a health consequence, then we'll manage his discomfort aggressively, including pain medicine. Traditionally now it would be oral Toradol as an example. We would use that, and we would do certain things, shoe modification, taping. And there is a role for injecting that situation with anesthetic. And for a playoff situation, it makes sense. If it was in the middle of the season, I don't think we would traditionally do that as a repeated everyday injection to get him through a week or two to get comfortable. This is just a little bit too much. We would probably put that player, give him a few days off before we'd inject it every day.